Welcome to the Eocene System, integrating technology to promote healthier lifestyles. Thank you for joining us on this brief systems overview. The Eocene System is a remote home patient monitoring platform designed for the management of chronic conditions. The user interface we are about to explore contains real-time testing data that can be viewed by population or per patient. Our system works with a complete line of products including glucose monitors, blood pressure cuffs, weight scales, point-of-care HbA1c measuring systems, cholesterol monitors, pulse oximeters, ECG monitors, and more. All of these devices can share their real-time testing results with this comprehensive disease management system that is capable of manipulating aggregate data into beautiful, easy-to-read and understand charts, graphs, and reports. Security of this personal medical information is trusted to two HIPAA-compliant HL7 servers located in California and at our home office here in Titusville, Florida. Feel confident that our Eocene Systems team will be there to assist in every step of this simple implementation process. Our trained, reliable response team will set up and help manage your patient's Eocene accounts. They'll walk them through the product setup and the transmission process, and then provide them with 24/7 bilingual customer support. Upon your initial setup into the Eocene System, you will have completed your physician enrollment form and will now have your own username and password. Once you start prescribing your patients to utilize the system, they will also complete a similar enrollment form and designate you as their physician. Their test results will then immediately be populated and available to view in your dashboard. Let's begin by logging in to the website at eocenesystems.com. Here you'll put in your supplied username and password and then click Login. The entire website can be navigated from the main dashboard. We have included a wealth of tutorials, instructional help videos, and definitions to inform and educate. If you get lost, don't worry, just look for the video reel icon next to each link in the system for quick how-to videos. The site is extremely intuitive and built on suggestions by healthcare professionals like yourself. So let's first click My Office Settings. As the title suggests, this system will allow you to personalize your passwords, manage multiple authorized users who will be able to make administrative changes to the testing ranges and alerts. You can specify account groups and branch offices, and you can even customize the banner at the top of the page to reflect your practice name and images. When you visit the site for the first time, My Account Settings will allow you to personalize the way that you want the system to present your reports, share information, and alert you to complications. Let's start here with My Custom Report Settings. This is where you select what reports that are important to you. Since the system is built for multiple entities, you may find one report that's more valuable than another. When you click on a patient's name in your database, the on-demand report selected here, along with the designated time frame and listing order, will be automatically generated. The My Patient Note Default section will allow you to share progress notes with other healthcare entities participating in the system that are involved with a common patient. This is a great place to share progress notes with your suppliers for their Medicare audit documentation needs. Activating your My Global Patient Alerts will notify you of potential complications before a costly hospital admission occurs. Each alert is thoroughly explained. For example, hyper and hypoglucose alert can make you aware of an unusually high occurrence of acute episodes. All activated alerts can be found in the Triggered Alerts links located on the main dashboard. Notice that when you scroll over each patient's name, their contact information is immediately displayed. You will receive one email each day notifying you if there are any alerts waiting for you in Eocene. Lastly, the My Global Patient Target Ranges are set and apply to all of your patients in the system. Later, I will show you how to narrow these ranges specific to a patient that may be in need of tighter glucose control. Now here's where you're going to spend most of your time, under the Patient section. This is where you will be able to monitor your entire population You can view at a glance their testing rate, last upload, and the amount of test strips remaining. These three icons will give you an easy access to the patient's information, reports, and notes. The first icon is going to give you access to the patient's individual settings. Here is where you can modify a specific patient's target ranges and alerts. You can view their reports, notes, and even a patient summary. In the patient summary, you can document contact and health information, medications, A1C and HEDIS scores, and manage all patient ranges and settings. This can be integrated over from an EMR format. Now let's back out and take a look at why we're all here, the patient reports. You can access their reports by clicking on their name or on the icon over here in the center. For this demonstration, we're going to concentrate on glucose reports. Notice that when we click on the patient's name, the on-demand reports that we designated in the My Office settings are automatically generated. You can access other reports with the drop-down selector. If you scroll over the test history report, you're going to see specific glucose scores. If the patient utilizes their meal and activity recognition icons in their meter, this will be presented on the report via color codes. Associating an activity to each score is important in understanding the patient's test result. At a glance, you can see how often this patient stayed within their target range by the shaded middle area, and how often they scored too high or too low by these bolded parameters. If there is too much data represented, click on the graph and drag in either direction to zoom in. Below, you will see that the graph is summarized. Average glucose time of day can identify the problem areas. If a patient spikes consistently before bedtime, you can focus on this and identify what's causing these elevated levels. It becomes more than numbers at this point. It's a snapshot of the patient's lifestyle. Sure, A1C scores are going to provide a 3-month average, but they don't tell the whole story. The real damage happens when they suffer from an acute episode. This is when a possible stroke or even a coma may occur, and an A1C is not going to show you how often this may be happening. So let's look here at the target range outcome summary. This is a quick and easy way to view and understand a patient's ability to manage their diabetes. Combine this with the test strip utilization summary, and you're going to get the whole story. Here, it shows that this patient tests 75% of the time within their target range. But when you consider that they're only testing at the prescribed rate of 83%, it's safe to assume that their target range percentage may be much lower if they tested as much as they should be. And finally, your patients will never have to keep a manual logbook again. Eocene records a detailed electronic logbook and provides a valuable summary of complete, accurate test history. As you can see, Eocene Systems provides healthcare professionals with accurate, real-time, aggregate data that will prove to be an invaluable tool in managing a population suffering from this epidemic. Understanding the disease is the only way to help people feel better and better manage their health. I hope you have enjoyed exploring what Eocene Systems has to offer. We have experienced and knowledgeable Eocene account executives ready to answer any questions that you may have. Please call us at 888-737-6595 to join us in changing the way that diabetes and other chronic conditions are managed today.